Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today we have an important topic, which is the screening for fetal aneuploidy and neural tube defect. This is a very important topic, really, and many obstetricians and other specialties are interested about this topic. Also, women from different parts of the world are interested about this screening for fetal aneuploidy and neural tube defect. Okay, what are the objectives of this lecture? The definition of aneuploidy, types of aneuploidy, how common is an aneuploidy, who is at risk of aneuploidy, the tests for aneuploidy, whatever it is, screening or diagnostic one, indication for prenatal screening, types of prenatal screening, non-invasive prenatal testing, diagnostic testing, and neural tube defect screening. Okay? So let us start with the definition of aneuploidy. What is aneuploidy? Aneuploidy simply is the presence of one or more extra chromosome or absence of one or more chromosome. So we know that normally the cell contains 46 chromosomes. If it is 47, so one of the chromosome represented by 3, as in trisomy 21, Down syndrome. So 47 is abnormal, of course, as in Down syndrome. The chromosome number 21, as in this picture, not paired, but there is trisomy, 3 chromosome of number 21 in spite of 2. So as the total number of the chromosomes now is increased to 47. So aneuploidy may be extra chromosome present or absence of one chromosome. So it could be the cell containing 47 if there is extra chromosome, or 45 if there is absence of one chromosome. Okay, both of them abnormal. Okay, this is as regard aneuploidy. So aneuploidy, there is defect in the number of the chromosomes. Either there is one extra chromosome or there is absence of one or more chromosome. Okay, okay. And as I said in this picture, there is an example of Down syndrome or trisomy 21, chromosome number 21. You will find 3 forms of this chromosome. So we call it trisomy 21. And the total number of chromosomes is 47. So what is the types of aneuploidy? We have, as I said, 2 main types of aneuploidy. Extra copy of chromosome, we call it trisomy. If additional copy of chromosome, we call it trisomy. So the cell may contain 47 chromosomes. If there is missing a copy of chromosome, we call it monosomy. So you should be familiar with this expression. Trisomy means extra copy of chromosome present and the cell contains 47 chromosomes, for example. Monosomy, a missing copy of chromosome. So the total number of chromosomes could be 45 in spite of 46. Okay? Okay? So give us example for trisomy and example for monosomy. Trisomy as in trisomy 21 Down syndrome, or trisomy 18 Edwards syndrome, or trisomy 13 fetal syndrome. While monosomy, one of the famous examples for monosomy is monosomy X in Turner syndrome, 45X0. All of us know Turner syndrome, there is absence of one of the sex chromosome. Okay? one of the sex chromosomes. So the total number is 45x0. Okay? So now we understand that aneuploidy could be trisomy or monosomy. How common is aneuploidy? Fetal aneuploidy and the chromosome disorder affect about 1 out of every 150 pregnancies and are responsible for about 50% of early pregnancy loss. Okay? Who is at risk of aneuploidy? Fetal aneuploidy really can affect any baby. Okay? Any pregnancy can be affected. The risk of having a child with fetal aneuploidy is higher among individuals who have a higher maternal age, with the exception of Turner syndrome. Okay? So, the risk of having a child with fetal aneuploidy, as in Down syndrome, is higher among individuals who have higher maternal age. For example, 20 years of age, the risk of having a child with a chromosome abnormality is 1 out of every 1,480 pregnancies. While at 40 years of age, the risk is higher, estimating 1 out of every 65 pregnancies for having a child with a chromosome abnormality. Imagine the difference between age of 20 and the age of 40 years. Okay, so the risk is higher, of course, at the age of 40 years or more. Okay, what about tests for aneuploidy? Please look to this figure. Tests for aneuploidy may be screening test or diagnostic test. Screening test may be biochemical test, serum test, or ultrasound scan. This serum test or biochemical test can be done in first trimester and in second trimester. For example, in the first trimester, I can do HCG, pregnancy associated plasma protein A. This is biochemical test done in the first trimester. In second trimester, I can do the double test, triple test, quadruple test, penta test, okay, and so on. So this is called biochemical tests in the first trimester and in the second trimester. Ultrasound scan in the first trimester between 11 and 13 weeks gestational age for nuchal translucency. The subcutaneous thickness of nuchal tissue. We measure the thickness using the ultrasound. If it is more than 3.5 millimeter, we consider it positive. Okay, so also we can search for nasal poon in case of Down syndrome. Absent nasal poon also suggesting Down syndrome. Increased nuchal translucency also suggesting Down syndrome or other aneuploidy. So this is called the screening test, biochemical or ultrasound scan. Okay, and the biochemical, as we will see later on, there is first trimester and second trimester. What about diagnostic test? Diagnostic test is confirmatory. You can swear this is a case of trisomy 21 or Edward or fetal syndrome. So how can you reach this diagnosis? By chorionic villus sampling, taking sample of chorionic villus and the evaluation of the cells for DNA and the chromosomal study, or amniocentesis and take fetal cells examination for chromosomal study. So either chorionic villus sampling, which is done between 10 weeks and 13 weeks, or amniocentesis, which is done after 15 weeks gestational age. So which one is done in the first trimester is the chorionic villus sampling. Amniocentesis is done in the second trimester at 15 weeks and onward. So this is called diagnostic test. We reach a diagnosis if the case is Down, Edward, Battau syndrome after diagnostic test. Screening test tell me how much is the risk of having Down syndrome or Edward syndrome or Battau syndrome, for example, in the baby. Okay, but diagnostic test is confirmatory using Carrier villus sampling or amniocentesis. Okay, aim of screening test. Screening tests are used to identify women at risk of fetal aneuploidy, such as trisomy 21, 18, and 13, and the fetal open neural tube defect. Are routinely offered to all women during pregnancy, regardless of maternal age. Indication of prenatal screening. The American College of Obstetricians and Gynecologists recommend that prenatal screening should be done for aneuploidy, and the follow-up diagnostic testing should be offered to all patients, regardless of maternal age or risk factors. Such testing should be discussed early in the pregnancy, and the patient should be counseled on the individual risk factors, screening sensitivity, and the importance of diagnostic testing. Okay, what about the maternal serum screening test? The maternal serum screening test is a blood test, simple like that, available to all pregnant women. It helps determine the chance of their unborn child having Down syndrome, Edward, or Battau syndrome, or a neural tube defect. Okay, what about the maternal serum screening? It is divided into first trimester and second trimester. Okay, during first trimester of pregnancy, between 9 and 13 weeks, you can do this test. When serum screening is combined with an ultrasound, this is called combined first trimester screening test. So, I can do maternal serum screening during first trimester between 9 and 13 weeks of gestation. Okay? But if I added ultrasound, this test is called combined first trimester screening test. Ultrasound, as I said before, for nuchal translucency, increased nuchal translucency detected by ultrasound. But ultrasound is done between 11 to 13 weeks, while the maternal serum is done between 9 to 13 weeks. Okay? Ultrasound is done between 11 and 13 weeks. Okay? If we add serum test with ultrasound, we call it combined first trimester screening. What about second trimester of pregnancy? Test, serum test, between 15 and 17 weeks of gestation is done. And this is called second trimester maternal serum screening test. So, as you see here, this is the types of prenatal screening. Both of them, the combined first trimester screening and the second trimester screening added to the maternal age. Don't forget the maternal age. Okay? So, if I added combined first trimester screening with the maternal age, I can receive the possibility of occurrence or how much is the risk that baby can be Down syndrome, for example, or Edward or Battau and so on. Okay? Also, for any of the second trimester screening tests, we should add the maternal age also. Okay? So, the two main big category, combined first trimester screening test and second trimester screening test. Let us go on. Combined first trimester, as I said, I have here two important tests. One, serum test for beta HCG, free beta HCG, and pregnancy associated plasma protein A. This is a serum test. And ultrasound for detection of fetal nuchal translucency sickness. Okay? Okay. This is the maternal serum marker. Maternal serum marker, as I said, done between 9 to 13 weeks gestation in the first trimester. Okay? While the nuchal translucency is done between 11 and 13 weeks plus 6 days gestational age. Okay? What is the nuchal translucency? Nuchal translucency refers to the subcutaneous layer of fluid behind the fetal neck and the lower cranium. This area can be visualized on ultrasound, and the increased nuchal translucency more than 3.5 millimeter in a fetus is associated with increased risk of chromosomal abnormality and the other diseases also. Okay? Don't forget during ultrasound to search also for nasal pool, because if it is absent, there is increased chance of Down syndrome. Okay? So, when you are doing ultrasound, search for nuchal translucency, measure the thickness, see if it is high risk or not. And before you finish, also search for the nasal pool, because absent nasal pool increases risk of occurrence of Down syndrome. Okay? Also, if there is increased nuchal translucency, you should evaluate the anatomy of the baby, detailed anatomical ultrasound, and the echocardiogram. Okay. What about second trimester serum screening? Second trimester serum screening options are double screen test, triple screen test, quadruple screen test, pentascreen test. This is before second trimester. This is not only the available test. In addition, there are combination of the first and the second trimester screening tests that include the integrated screen, the stepwise screen, and the contingent screen. We want to understand this expression. Okay, we'll see later on. First, what is the test done in double screen in mid-trimester? The double screen measure HCG and the maternal serum alpha fetoprotein. That's why we measure two factors, so we call it double. Triple, we will measure the previous two, HCG and the maternal serum alpha fetoprotein, and you can add here a new one, unconjugated estriol. Okay? Okay. This is the triple screen. Quadruple screen, which is the most important right now and the most commonly used these days. This is a quadruple screen. Quad screen. You can say also quad screen. Okay? What is the component of this screen? We measure HCG, maternal serum alpha fetoprotein, unconjugated estriol, and the inhibin A. Okay? Okay. And this is a more sensitive and more specific one than the previous test in second trimester. Okay? You can see here how the quad test differentiate Down from Edward, from Batau, from Turner syndrome. However, it is not accurately diagnosing Batau syndrome, but diagnosing Down, not diagnosing, sorry, we are screening, sorry, detecting the high risk of Down, Edward, and the Turner, but to less extent the Batau syndrome. Okay, so it is a screening method. For example, in Down syndrome, we measure alpha fetoprotein, HCG, estriol, inhibin A, as I said before. In Down, you will notice that HCG is high and inhibin A is high. In Edward, HCG is very low, estriol is low, alpha fetoprotein is low. In Patau syndrome, alpha fetoprotein increased while HCG, estriol, inhibin A unchanged. In Turner syndrome, alpha fetoprotein is low, HCG is very high, estriol is low, inhibin A is very high. Okay, let us go to the pentascreen. The pentascreen measure 5 items: HCG, maternal serum alpha fetoprotein, unconjugated estriol, inhibin A, and hyperglycosylated HCG. Okay, so the pentascreen added one more item than quadscreen, which is a hyperglycosylated HCG. So what is the integrated screen? What does it mean? Integrated screen is a combination of the result of first trimester combined screen and the second trimester quad screen into one result given after second trimester screen. So look to this figure, please. The case already done first trimester combined screen, okay, and I didn't give her the result till we did the second trimester. Combination of both the combined screen, the first trimester combined screen, and the second trimester screen give me the integrated screen with more accuracy in result in such condition. The integrated, because I depend on the first trimester combined screen and also second trimester quad screen, quadruple screen. I added both results to each other, give me the integrated screen, and this is more accurate than any other test. Screening, the other screening test. Okay. What is the stepwise screen? Stepwise screen is like the integrated screen in that it combines first and second trimester screen. However, patients here are given their first trimester screen result yearly. If you remember in the integrated screen, I said we didn't give the patient the result of the first trimester till we finish the second and add the result to each other and getting the integrated screen. You understand? So we didn't give the patient the first trimester combined screen, an integrated screen. But in a stepwise screen, we give the patient the result of the first trimester screen yearly. The patient may go straight to diagnostic test if the first trimester screen is positive, at which point the stepwise screen would be discontinued. A patient with a negative first trimester screen is notified of the result and to continue to the second trimester quad screen. Look to this figure to understand more the stepwise screen. We are going to do first trimester combined screening test. Okay? Okay. Then we will give the patient the result. If the result was positive, the patient may choose to go ahead for chorionic villus sampling to diagnose the condition. Okay? Okay. But what if the result is negative? If the result is negative, we are going to continue to do quad screen. Okay? So this is called stepwise screen. So what is the difference? The difference here, we did first trimester screen and the result either positive or negative. If it is positive, we can cut it short. Cut it short means what? Reach the diagnosis by doing chorionic villus sampling to know if there is aneuploidy or chromosomal abnormalities or not. But what if the result is negative? We are going to do quad screen in mid-trimester. Okay, this is called stepwise screen. What about the other expression, the contingent screen? The contingent screen. The contingent screen gives the patient the result after the first trimester screen and stratify patient into low, intermediate, and high risk group. Look to this figure, please. We did first trimester screen test. Okay? Then we have here three results, either positive, negative, or intermediate risk. If the result is positive in contingent screen, we are going to do chorionic villus sampling in the first trimester. If the result is negative, we'll stop. No more evaluation. No more screening test. If there is intermediate risk, we are going to continue to do quad screen. This is the contingent screen. Okay? I put this table to show you the performance of different methods of screening for trisomy 21. This is the method of screening, and this is the detection rate in percentage. As you see here, high detection rate in combined test with nasal bone or tricuspid flow or ductus venosus flow, evaluation of the fetus by ultrasound. Okay, with the serum test in first trimester, carry high detection rate as you see. Also, if you see here the combination of the first trimester combined screening test with the quad test, reaching high detection rate, reaching 94%. Okay, let us go to the very interesting title developed in 2012, which is non-invasive prenatal testing, cell-free fetal DNA. What is the non-invasive prenatal testing? We call it non-invasive. Why non-invasive? Because all what we need is just a sample of the blood from the pregnant woman. Okay? We are going to search for what? For fetal DNA, cell-free without boundaries, fetal DNA wandering in the maternal circulation, related to the trophoblast. Okay, so we call it fetal origin. So this DNA should be evaluated, and it was found that this test to detect chromosomal abnormality, highly accurate screening test. Highly accurate screening test, but still it is a screening test, not diagnostic test. Please remember this very well. The only diagnostic test we know is the chorionic villus sampling and amniocentesis. But here, this is considered one of the screening tests, but carry high sensitivity, reaching 99%, and the high specificity, reaching 99.5%. Okay? The American College of Medical Genetics and Genomics recommend that patients should be educated on the availability of cell-free fetal DNA as a screening method for Down syndrome, Edwards syndrome, and the Patau syndrome, as well as its utility in the screening for sex chromosome aneuploidy, like Turner syndrome. Okay? Non-invasive prenatal testing is a screening test that needs confirmatory invasive testing in case of high-risk positive result. Okay? As you see in this picture here, this is in blue color or violet color, this is the cell-free fetal DNA. Okay? This is a maternal vessel. This is the maternal DNA. I can differentiate maternal DNA from cell-free fetal DNA. Okay? This test is very interesting, carry high sensitivity, high specificity, as I said, non-invasive test, but it is costly. So it carry a higher cost than any other screening test. This is one of the limitation for doing this test is being costly. Okay, higher cost than other screening tests. Cell-free fetal DNA compresses a small fragment of fetal DNA thought to originate from trophoblast, like this one, cell-free DNA, this one. Okay, these fragments circulate in maternal plasma and form approximately 10% of DNA fragment in maternal plasma. It is present in a reliably measured level, measurable level for aneuploidy screening from 10 weeks. So, if I asked you when to start to do cell-free fetal DNA, I should exceed gestational age 10 weeks or more. Okay, 10 weeks or more. And this cell-free fetal DNA remain in the circulation of the mother till delivery. So you can say it is specific to that pregnancy. So you can detect this DNA inside the maternal circulation from 10 weeks up to delivery. This is the maternal vessel, as I said before. This is the DNA of fetal origin. This is DNA of maternal origin. I am searching for this one to test for chromosomal abnormalities. Now we finished all screening tests for aneuploidy. Now our time to do diagnostic test. What is the diagnostic test? Diagnostic test simply chorionic villus sampling and amniocentesis. The possibility of diagnosing reaching up to 100%. Okay, diagnostic test is a universally recommended in the occurrence of positive screening test regardless of screening modality. Chorionic villus sampling and amniocentesis and are diagnostic tests that detect chromosome condition in the unborn fetus. Okay? What time you are going to do the test? Which is gestational age? Chorionic villus sampling is performed in the first trimester from 10 through 13 weeks gestation. Amniocentesis can be performed started at 15 weeks gestation and onward. Okay? This is simply, and I have a previous lecture about chorionic villus sampling. You can find it on my YouTube channel. Okay? Neural tube defect screening. This very important item. This is very important congenital anomaly that develop when a portion of the neural tube fails to close normally during third and the fourth week after conception. Third and the fourth weeks after conception mean the fifth and the sixth weeks of gestation. Okay? So, the congenital anomaly here occurred due to what? Due to failure of the closure of the neural tube, which normally during the third and the fourth weeks after conception. So, we define neural tube defect as a congenital anomaly that develops when a portion of neural tube fails to close normally during third and the fourth weeks after conception. Okay, as you see in this picture, this is an example of neural tube defect, spina bifida, meningocele, and myelomeningocele. What is the difference? Here is the herniation of meninges through defect in the vertebra without nervous tissue. Here is the herniation of the meninges with nervous tissue, so we call it myelomeningocele. This is famous type of neural tube defect. The other famous type of neural tube defect is anencephaly also. Okay, so the most common neural tube defect are anencephaly and the spina bifida. About 70 to 90% of open neural tube defect and the 95% of anencephaly can be detected by elevated maternal serum alpha fetoprotein. This is our target, to measure maternal serum alpha fetoprotein. At which gestational age we are going to, and what is the optimum time? The optimal time at 16 up to 18 weeks gestational age. This is as regard neural tubal defect screening. The laboratory should be informed of the gestational age at the time the sample was drawn for an accurate interpretation. So please, when you send the sample of the blood to test for maternal serum alpha fetoprotein, please write the gestational age in your report, okay? Because it is important. And as I said before, it is better to take the sample, the blood sample, to do the test between 16 and 18 weeks gestational age. Okay, what about maternal serum alpha fetoprotein? The test is most accurate if laboratory is also informed of maternal weight, race, presence of insulin-dependent diabetes, number of fetus, and the family history of open neural tube defect. Why these factors? These factors are used to adjust the multiple of the median level because there is variability according to this factor. So the measure here in serum alpha fetoprotein is called MOM, multiple of median level, okay? And the cutoff level of maternal serum alpha fetoprotein for open neural tube defect is 2.5 MOM or more in single-tone pregnancy, and 1.9 or more for insulin-dependent diabetes, and 4 or more MOM in twin pregnancy. So the cutoff in single-tone pregnancy is not like that of twin pregnancy. In single-tone, the cutoff maternal serum, if I found it, I said this is high risk for neural tube defect is exceeding 2.5 in single-tone pregnancy. But if it is exceeding 4 in twin pregnancy, I'll say, yeah, there is high risk for neural tube defect. So it differ according single or twin. Also in insulin-dependent diabetes woman, the cutoff is 1.9 or more. Okay, the second item in neural tube defect screening, rather than maternal serum alpha fetoprotein measuring, is ultrasonography. Ultrasonography during first and second trimester is recommended in high-risk pregnancy to detect the presence of anencephaly, spina bifida, and encephalocele. In cases with elevated maternal serum alpha fetoprotein, ultrasonography is recommended. So if I do test for maternal serum alpha fetoprotein and it was positive, I should do ultrasound. Why I should do ultrasound? To confirm gestational age, to detect the presence of twin, if it is present, or single-tone pregnancy, to diagnose anencephaly or spina bifida. So ultrasound will detect any structural defect, like anencephaly or spina bifida also. This is the end of my lecture. I hope it was clear enough. This is my books published on Amazon: textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology book published recently. Please go to Amazon to find my books, and you can find also sample there. Okay, I'll put my site on Amazon as a author on one and comment also in the description of this video. Also, I'll put the link of my YouTube channel where you can find other videos. My best wishes for all of you. Thank you, everybody.